just and safe communities for all, and that includes access to abortion for young people. The Youth Abortion Support Collective is a specific collective within Advocates for Youth of over 200 young people who are committed to supporting other youth in their communities through forms of practical support and emotional support in order to gain access to abortion in their communities. So a few rules for today. Only the Advocate staff will be screen sharing. Please chat. We love to have a lively chat throughout. Feel free to ask some questions. At the end of the event, we'll have a question and answer session where we'll be pulling from those questions. So if your question isn't answered right away, we probably have stored it for a little bit later in the conversation. Also, any lewdness or excessive profanity or any conversation that is stigmatizing, especially stigmatizing to people who have had abortions, will result in removal from the space. And also, this workshop is going to be recorded. In order to turn on some live captions, you can see on your own screen down at the bottom, there is a closed caption section where you can click closed caption and click show subtitle. If you have any questions about closed captions or any technical issues throughout our event, please chat, and Emily, our incredible tech support and communications director at Advocates, will support you. We also have ASL interpreters on the call with us. Danielle and Rachel are here tonight. They switch off periodically. So if one interpreter seems to leave and you don't see them on the screen, just look for the other interpreter. They will be spotlighted as well as our other speakers. And tonight we actually won't be doing breakout rooms. So that last point, you don't need to consider. These are a few just ways to stay in touch with Advocates for Youth. If you're interested in our work, interested in following us, here's our Twitter handle, Instagram, and also our website. And if you go to our website, there's an opportunity to add your name and email to our email list as well. So we'll get started with our panel. I'd like to take a moment to introduce Victoria, who is our panel facilitator tonight. Victoria Torres Garcia from Abortion Out Loud is a reproductive justice activist committed to destigmatizing abortion and expanding abortion access in the Northwest side of Chicago. She is an abortion storyteller with We Testify and with Advocates for Youth. And Victoria works in her community offering practical support as a case manager at the Chicago Abortion Fund. And she also helps co-host a support group for those who have had abortions. Victoria, thank you so much for joining us and for leading our panel today. I'll hand it off to you for the rest of the introductions.
Welcome again, everyone. We are here tonight because even though we're grateful for the legalization of abortion, legalization alone is not enough. And so today these panelists will be sharing how community support and mutual aid are powerful tools for abortion access in a time where many people are living in a world where legalization alone is of abortion doesn't do much. And so I want to take a brief moment to introduce our panelists. We start with Kathy Torres. She, her pronouns. Kathy Torres is a board of directors for the Frontera Fund and is a member of the Young Women of Color Leadership Council at Advocates for Youth. Kathy is based in Rio Grande Valley in Texas, and she has been involved with the Frontera Fund for 5 years and with Advocates for 4 years. Next, I want to introduce Noor, who uses they, them pronouns. Noor is a passionate lifelong community organizer dedicated to creating and practicing strategies for resistance, survival, accountability, and joy. They are a disabled queer and trans activist, educator, and artist of South Asian descent. In 2013, they co-founded Cicada Collective, a QTPOC-centered reproductive justice organization that helps reduce the barriers to reproductive care for all by providing abortion access, support, doula trainings, trans community networks, and comprehensive sex and gender education in North Texas and beyond. They are also leader of the Sex workers outreach project in Austin, where they help cultivate safer spaces and redistribute resources for sex workers in need, and a coordinator at Inside Brooks Project Archive, where they help manage a collective of art and writing submitted by incarcerated individuals across the USA. Next, we have Seneca Joyer, who uses she, her, hers pronouns. Seneca Joyer is a director of community organizing at Women's Medical Fund, one of the oldest and largest abortion funds in the US. At Women's Medical Fund, Seneca's responsibilities include stewarding the work of the Philadelphia Reproductive Freedom Collective, as well as crafting the fund's organizing mission, strategies, and campaign. She is a world historian, a Muslim, and anarchist who has been organizing toward Black liberation for decades. She moved from Massachusetts to Pennsylvania in 2015 and currently lives in North Philly with her kid, spouse, and their cats. Next, we have Kefri, who uses she, her, hers pronouns. Kefri is a member of Cascades Abortion Support Collective, CASC, a non-hierarchical grassroots organization in Portland, Oregon. She is an abortion doula and practical abortion support lead, and she is a graduate of the Evergreen State College, where she focused on social justice and writing. When Kefri is not dedicating her time to CASC and the local reproductive justice movement, she's farming flowers and snuggling her miniature goats and other animals. I just want to do a quick reminder to remember to use the chat for any questions you may have. We will try to answer as many possible questions in the QA after the panel discussion. And to kick off the panel, I want to first open up this question for everyone. And the question is, while we understand that Roe is important, what gaps does federal legalization of abortion leave? Can you tell us about the need for mutual aid for abortion access in your communities? How does mutual aid for abortion access tie into the larger reproductive justice movement? And again, this question is going to be open up to everybody.
I think I'm happy to start because it feels like part of the answer to that question is a historical one, and I don't waste any opportunity to put this giant student loan to good use. So as maybe some of you all are aware, the Roe v. Wade ruling, which has been trumpeted by particularly the United States government and people who support abortion legalization, was a watershed event. But for those of us, particularly who have tried to access abortion care in the 4 decades afterwards, and also people who specifically study the impact of Roe v. Wade, what it made possible was that while the so-called privacy of certain individuals in the settler colonial state of the United States was enshrined in law, what it allowed for people who hate abortion and for people who are seeking to control it to do was to target how abortions are paid for. And so, in addition to that, it enabled people to sort of like hide exactly what is the purpose of anti-abortion legislation, specifically like the white supremacist underpinnings of that work. And so while our government to some degree was able to say, see, look, it's legal, there, are you happy? But the reality was they immediately, and I mean immediately, both the United States government and people who are against abortion were able to target how the vast majority of people pay for their abortion care, i.e. through insurance, both public and private. And so both from that historical moment and every single day afterwards, the ability to pretend as if people's access to abortion was some sort of limited notion of choice or privacy, or even that anybody in this country has so-called equal access to healthcare, has been a humongous obstacle, not only in those of us who live in this country, but also those who recognize those problems to organize against it. And so in this very, I don't want to call it a paradox because a paradox implies accident. It was designed intentionally to sort of like muddy the waters about what is really at stake when certain people tell other people that they don't have control over their bodies, or when they get pregnant, or when they stop being pregnant. But it became like this lightning rod that people could argue about and fight about, while in the meantime, in the other side of the room, or sometimes in the same room, they were able to forbid, you know, every single other opportunity that was available to people to not only pay for their abortion care, but in order to create all of these logistical barriers in front of it. I live in Pennsylvania. We had the first abortion control acts in the nation. All of the other abortion control acts that exist in the United States follow the Pennsylvania Abortion Control Acts, because they were the ones that were first upheld by the US Supreme Court. And in them, only one part of the act talks about insurance funding for abortion care, and all the other parts of the abortion control acts talk about who can provide abortion care, when you can get it, under what circumstances. And as recently as today, our legislature, like every time they get together, they've got like 16 other laws and bills that have nothing to do with privacy and everything to do with how we fund abortion and the logistical practical ways to like physically obstruct people being able to access care, particularly if you want to access care in a clinic or a hospital. And so for me, both like in a historic sense and in a contemporary sense, every single day we like live the reality of how sort of pretending that you can tie a little bow around like this enormous issue of bodily autonomy and of personal liberty, and just say, well, it's privacy and we're all done with that, means that you can actually change fundamentally not only how the government relates to people, but like what kind of power people are able to like find and exercise in their own communities. And so I feel like that's like kind of the first part of the question, because it's one of the things that we confront every day, because people are always like, well, it's legal. And as you know, you said, Victoria, that doesn't mean anything because of course it doesn't stop people from being criminalized for accessing or providing abortion care, even with Roe v. Wade sort of like off in the stratosphere, sort of like fuzzily hanging around. So that would be the first thing I would say.
Yeah, I can go next. Yeah, Seneca put it perfectly. And I do want to like kind of continue that Roe v. Wade is essentially the low bar. Like anti-choice lawmakers since Roe v. Wade has passed have consistently placed bogus restrictions on abortion, primarily targeting low-income people of color. Like take the Hyde Amendment, for example. Henry Hyde explicitly stated that if he couldn't ban abortion altogether, he would just make it impossible for low-income, pregnant, capable people to access it. Literally said that, and he did it. So, and how did he do that? By banning federal funds from covering abortion and by restricting Medicaid in general. Like, how mean and how evil is that? And it was just to fuel their agenda at the time. And this was like Seneca mentioned, right after Roe v. Wade was passed. So mutual aid efforts are extremely necessary because we're unable to rely on Roe v. Wade's bare minimum approach to abortion access. Abortion funds are sort of like the perfect example. Abortion funds will utilize a lot of community donations and hold grassroots fundraisers to directly fund people's abortions, or to alleviate travel costs and any other additional costs due to ridiculous laws that states often put into place. Like Texas has a mandatory 24-hour waiting period, mandatory ultrasound. And then certain clinics around like where we live, like here in the Valley, here in McAllen, we're the only clinic south of San Antonio, which is 4 hours away, and their max is about 17 weeks. So that's why we kind of have to fund all those additional funds like gas, sometimes bus tickets, airplane, hotel, ground transportation, you know, all of those things. So we sort of help alleviate that because Roe v. Wade doesn't assist with any of that. And then lastly, most directly, how does like a mutual aid for abortion access like tie into like the RJ movement or reproductive justice movement? Most directly, economic justice is reproductive justice. So like kind of like how I described earlier, financial barriers are purposely placed to keep low-income people from accessing abortion in an attempt to fuel a nasty, twisted, anti-choice, classist, and white supremacist agenda. Mutual aid efforts work to dismantle these like financial barriers so people can make their own conscious decisions about their own lives. So like we deserve to make our own decisions, we deserve our own autonomy, and mutual aid helps us do just that.
I'd love to chime in there. I think both of my co-panelists make really excellent points. And I think that we have to think about how Roe does nothing to prevent states from passing all sorts of additional barriers. And that's something people who are just thinking about it being legal aren't really thinking about. And for instance, in Texas, when Texas passed laws that forced many clinics to adopt completely unnecessary hospital standards for their facilities, it forced a lot of clinics to close. And Texas is already a huge state, so distance was already a barrier, but that became an even larger barrier, particularly for people who couldn't cross a border or a checkpoint without fear of being incarcerated. And so on top of that, restrictions have been added, like Kathy mentioned, that add to the number of days and visits that people have to make to a clinic, which again adds more barriers, especially if you are economically unable to access travel, access a hotel, if you have to be secret in the process of getting an abortion, if you can't share that with people in your life, that adds additional layers of barriers that often prevent people from even being able to get to their appointment at all, or they get to their consultation and never make it back. Or as a doula, as we frequently see, people get through their appointments, but they never make it to their follow-up, which is a really important appointment to make it to, but most people never make it to that one. Because all of the governments and all of these restrictions, rather than protecting people's health, are there to put these barriers in place. So the focus is really not about preserving people's health, because if it was, there would be a lot more importance placed on making sure people got the appointments that actually mattered, instead of making extra arbitrary appointments and extra barriers and making people have to go through things they shouldn't have to go through that add an emotional and financial and legal toll. And I think another really important point is that there's clearly lots of proofs that all of these barriers are cruel and unnecessary. But recently, especially during the pandemic, we've seen a rise in self-managed abortion and people both wanting access to it and accessing it successfully. And I think the rise in that demonstrates more than anything that access to abortion is safe and essential, and that many people living here would rather rely on autonomous methods than have to go through the emotional, legal, and financial toll that our laws and social practices create for abortion seekers. So I think culturally, that's something that's really important to think about. And then in terms of how mutual aid for abortion access fits into the larger reproductive justice movement, absolutely, economic justice is reproductive justice. Anything that affects our ability to achieve bodily autonomy is reproductive justice. And so that's intentionally a very broad and expansive definition, because it includes many, many issues within it. Right. And I feel that it's important to recognize that when we have access to resources that others do not, it's our responsibility to share it. Like that's the heart of mutual aid, is that there's an abundance of resources, not a scarcity. And so we should be sharing that, because if we share all of the resources we have across networks, we can meet so many different people's needs. And then in terms of how the need for mutual aid for abortion access arose in my community, because I specifically work among queer and trans people of color. And so when I helped start my mutual aid network, Cicada Collective, it was us as a group of young queer and trans people who were dissatisfied with the ways that we were just not represented or misrepresented, and the narratives around reproductivity that did not include us. And we wanted a way to amplify and support others who shared our identities and who were seeking abortion in Southern and conservative states. Which is a lot of different multifaceted things, but it was very important to us to find and create resources for us and by us. And so we created a queer and trans people of color centered abortion doula curriculum. And then we also recognized in doing that, that while abortion doula services are really important, they were, I hate to call them a luxury because they are a need, but they became a luxury in the current climate when we realized that there were so many barriers like transportation access, childcare, and lodging that people were not able to get to their appointments because of that. And so we created the North Texas Abortion Support Network to try to supplement that gap. Since there are already so many abortion funds, we were trying to help people get between getting their abortion funded and actually getting in the door. So initially we provided volunteer transportation, housing, and childcare. And then because of the intense need, we weren't able to keep up with that. So we focused on transportation. But all of those things are really important and are huge barriers to people being able to get access to reproductive care of any kind, healthcare access of any kind, but especially abortion because it's so targeted and criminalized.
Thank you for sharing. You all are so incredible. I will try to fill in some gaps, but yeah, I guess the first thing I would say is that I'm in Oregon. And so Oregon is one of the few states I would say that responded to Roe versus Wade by filling in those gaps. In 2017, we passed the Reproductive Health Equity Act, which allows state Medicaid to fully cover abortion. And so we get a lot of people that travel from abortion deserts, so places like Idaho and Nevada, to come and access abortion in Oregon. And we go up to a 26-week gestational age limit. And so we don't necessarily, there are times when we have to fund abortions, you know, if people aren't qualifying, if they're not making the minimum amount or the max low income, we will fund their abortions. But a lot of the work that we do really surrounds transportation, and we have a huge network of volunteers and transportation support, lodging. We also do meal support, which has been a really amazing gift. We've partnered with local restaurants who also believe in mutual aid and offer us free food to the people that we support. And additionally, we also do like aftercare kits. So we offer you know, your usual aftercare supplies, pads, heating pads, candles or ibuprofen, socks, things to keep you cozy and feeling safe. And what else? In terms of the way that it's tying back to reproductive justice in the broader scale, mutual aid and community care has always been a way of responding to state violence and police brutality. And I would say that that is where we learn a lot of our tactics, is from anti-racist movements. I've also seen in Oregon, or Portland in particular, a huge surge in understanding of mutual aid and support for mutual aid. So we have, you know, we have a childcare collective here that we're partnered with. We have an amazing houseless community, like support community, and helping those people access the healthcare that they deserve. And so I would just say that like the anti-racist movement is leading the way for mutual aid, and it just goes hand in hand with reproductive health and reproductive equity, and you know, ties us back to reproductive justice.
Yes, thank you so much. And I want to go back to you, Sanika, with this question. What motivated you to get involved in mutual aid work? And what are the biggest lessons and key takeaways you have learned about how to do mutual aid work effectively?
Yeah, thank you. That is a great segue, particularly after everything that the other panelists have said, but particularly Kefri, because I come to this work as someone who is committed to Black liberation, and I have never done abortion organizing separate from my work to liberate all Black people everywhere. And when I came to Women's Medical Fund, there was a real determination as an organization that had been around for a really long time that needed to intentionally pivot away from like this prevalence of like charity and good works, and really reground themselves in the notion that being able to fund and access abortion within community by community members for community members is actually the natural state of abortion care. Again, before it was criminalized and professionalized, again, starting right here in Philadelphia, this is how everyone everywhere shared knowledge and expanded their skills and cared for each other. And again, even in the presence of having to pay for abortion care. And that recognition really required like, I don't want to say like a recentering of where we were doing our community organizing work, but it became an opportunity to say out loud why we were focusing so much in our community, and particularly in the communities and in the demographics of people that are absolutely 100% fully and just as out loud targeted by white supremacist state violence across the board, using both their reproductive lives and particularly abortion as like that specific and particular site of violence. Philadelphia is the largest poorest city in the United States. it shouldn't surprise anybody to know the vast majority of those people are Black cis women who are parenting at least one kid, and that the deepness of that poverty meant that we were not ever exclusively talking with people about abortion, but that we were like talking with people about, you know, why do sober living homes not allow you to have your kids there? And what is the situation with mandatory reporting in Pennsylvania? Why does the broken foster care system still take more children out of Black women's homes in Philadelphia than any place else in the country? We were already in our communities talking with people about that. And then about 3 years ago, this sounds maybe a little bit corny, but like we were just about the business of being in those communities of people, particularly in North Philadelphia, that are not deemed respectable or redeemable, because these are people who engage in sex work, who use criminalized drugs, and are houseless or living on the street. And we were just about the business of being in community with our community members. And one of them got a hold of a zine that we had made about crisis pregnancy centers. As they are a problem everywhere, they are a huge problem in Pennsylvania. Our non-hierarchical collective, the Philadelphia Reproductive Freedom Collective, had just pulled together a zine that was specifically trying to alert people in our community to how to tell the difference between CPCs, where they are, this, that, and the third. And one of our community members was like, I found your zine. And also these people were out under the L, like talking to us about coming in to the crisis pregnancy center. And through that conversation that was already a regular relationship that we had through another organization that was doing direct service and mobilizing, particularly with people using drugs and people engaging in sex work, we were able to not only realize that our opposition was specifically, big surprise, targeting those most vulnerable, but we were actually able to be in conversation with what they wanted us to do to be able to equip them better to withstand that targeting. And so our first years ago, I say years, like through the midst of time, but our mutual aid effort, arguably abortion funding, especially at WMF, is mutual aid because of the way that we both fund and disperse our money. But definitely years before COVID, in response to how these anti-abortion organizations were targeting our most vulnerable populations, they told us it was happening. We asked them what we could do to support them, and we came up with this first mutual aid initiative, which was both providing barrier contraceptive methods and emergency contraception, which, for folks who don't know, is available over the counter in Pennsylvania, not in all states, but it is also pretty expensive, especially if you're houseless. $20 does matter. As well as information about how to access abortion care and how to recognize if you're being basically targeted by an anti-abortion crisis pregnancy center. And with those, like that bundle of information, and again, marrying an already established relationship with a desire to like build power in that community, not just providing a service, because we were really careful about how that, of course, isn't mutual aid, right? We're not a direct service organization. We are about helping facilitate people, you know, catalyze their movement and build power in their community. We were able to not only come up with something that fulfilled the needs of the community, but also provided them with the specific information they said that they lacked, right? People knew what abortions were, but they didn't know what crisis pregnancy centers were. And people knew that you could technically get an abortion in Philadelphia, but specifically offering tips, and I hate to say this, but tricks about how, particularly, like, for example, someone without an ID, or someone who has no phone, or someone who has no address, some very, very low barrier issues that do come up when you're accessing clinical and hospital-based abortion care, can actually overcome those obstacles, was like our first mutual aid effort. And then when COVID hit, again, our clinic partners were like, we are under attack. The legislature is trying everything, you know, that they can to shut us down. And also we're trying to protect our patients and our providers. People need to keep their distance. We are, you know, having these constraints about who can be in the clinic and why. And it would be really great if there would be one thing that we didn't have to worry about with respect to people coming into the clinic. And so again, being in community, this time with independent abortion care providers presented us with another like opportunity to take something out of the abortion clinic that didn't need to be there. And we developed this reproductive mutual aid project that constructed both the logistical and, because we love zines, a whole new zine about how to access abortion care, particularly in the COVID times. And what that was different, why that was so different for us this time is because before we were able to like physically be in what I like to call meet space with other people, and that made conversations about needs, that even made like, I mean, as you all are now fully aware, because this was the creation of the Repro Mutual Aid Project was April of last year. The logistics of being able to not only find out what kinds of barrier contraceptives and emergency contraceptives people need, but also being able to take into account the risks people face when questioning or trying to seek out abortion care. There are no protections in Pennsylvania. People lose their housing. People experience a tremendous amount of violence. People struggle with knowing what is real information, what is not real information. And so like directly out of these relationships that we had already had and were like always deepening, we were able to not only see like where the gap was in that current moment of crisis, but we were able to say to people, so this is actually a crisis that is manufactured. This is something that will continue as long as capitalism continues. And so, yes, we are here to offer you condoms and EC, but also we want to remind you that all of this stuff that you have to do just to access your health care is a fiction created by the state. And when we band together, we can actually fight against it. Because, and I say this because it is important, at the same time, Philadelphia was also gripped by anti-state violence uprisings. And so at the same time that clinics were closed, all other services across the Blackest parts of Philadelphia, which is important to acknowledge. We had National Guard troops in our city all last summer, not everywhere, just in North and West, that people couldn't even go to the Rite Aid. People couldn't go to the grocery store. Shit was closed. And so being able to not only connect this place of restriction and surveillance that those of us who work in abortion funding and organizing know all the time, to the experience of this violence that our community had experienced all the time, and say, our state has created this crisis, but we are the solution to it, was extremely pivotal. And I think that's another thing that I wanted to touch on, because I feel like all of the other panelists have mentioned it too. The context of these mutual aid is so unbelievably critically important. We didn't have to explain to people why mutual aid was important. We just had to say, hey, this is what we're doing and this is why we're doing it. And people were like, bet, we're on it. And that's because that's how Philly is. And I would say that those are the things that brought us to that moment, and that we were having to innovate in ways that I think we're still sort of learning. But the biggest takeaways, I think, for us were, like I said before, beware of direct service creep. I don't know if that's what people call it, but institutionalization is a real thing. The nonprofit industrial complex exists, and particularly in health and human services, where there are organizations that work with the government and don't work with the government, there is both this explicit and implicit tendency to turn mutual aid, which is a direct action that is, you know, catalytic and amazing and radical, if you're doing it right, into direct service, which is philanthropic and white supremacist and charitable. That is really difficult. And so being mindful of like what we were redistributing to our comrades, right? Who we were partnering with, we were very careful. Some people were sending us, they were like, oh yeah, CPCs give out stuff. We're like, whoa, you know what I mean? Who we were partnering with to redistribute stuff at this last summer as well. There were 2 huge houseless encampments in Philadelphia that were very different, but extremely important to like advancing the issues that needed to be dealt with in the city, and how we resource those different encampments. And like, we're committed to like also their goals, i.e. dealing with the Philadelphia Housing Authority, as well as police violence, was really important. The other thing that I would say is that you need to set the access logistics at the barrier of your least available community members. And what I mean by that is that, especially in the 21st century, there is a tendency for everything to be virtual. There's a tendency for people to throw out, honestly, 19th century technologies like telephones and paper in favor of organizing on Facebook and sending text messages in ways that can be extremely crippling or undermining, when we know that in this day and age, state surveillance and censorship of words related to sex and abortion is at the highest that it's ever been. Ask our homies that are working at Sesta Fosta to this day. And that we had to think about like the logistics of our project that couldn't just be all online, but that it had to take into account who are the people that needed to access reproductive health care and who are the people that we were trying to mobilize. And we had to combine those hybrid methods. And I would say the last one would be, well, yeah, I guess those two things are like related, that we were able to combine both traditional and more, I guess you could call it, new media methods, but we were absolutely not able to do any part of the work with just like all online organizing or even just like all in meet space organizing, and that we actually had to combine them and had to think extremely intentionally about access along language, intellectual capacity, age, and also technology and what do you call it, resources. And those are like my three biggest takeaways. I know I just said a ton of stuff, but yay!
No, yes, that was great. I would love to see that, zine, and as someone who's had two abortions and falling victim to a crisis pregnancy center, I definitely understand what and how necessary it is to get the resources needed to get real reproductive care. I'm gonna leave this question for Kathy. Our second question is, what tips do you have for grassroots fundraising and collecting funds for abortion, especially in a moment where so many folks are struggling financially?
Thanks. Awesome question. And thank you, Seneca. That was like really eye-opening. And just kind of reaffirms like these struggles that people experience and shouldn't be experiencing. So for sure. So I guess like just to offer like a few tips in general, like generally speaking, whenever I organize like a fundraising event, or our fund organizes a fundraising event, the first thing I think about is, okay, how are we paying for this? So I set up my budget, and honestly, like especially like if you're maybe doing youth organizing or you're organizing on campus or you like know of orgs that you've worked with, contact them and just sort of let them know what it is that you're planning on doing. And more often than not, they're more than willing to fund your event or some of your event. Just sort of present them with the idea, the simple email. Worst thing they can say is no, they can't. So that's always something that like I really want folks to know, that like use these organizations to, as a resource. That's what they're here for. And that's what they want to help do. A lot of times they want to uplift your efforts. So that's one tip. Another thing that I mainly suggest, especially in the context of mutual aid, don't underestimate how your community feels about abortion. Honestly, like more often than not, overwhelmingly, they're down for it. It's just something that people don't talk about. Remember that stigma runs so deep. So like last year, for example, our fund organized, it was last April, and we all know how April 2020 was, right? So last year our fund organized a no contact bake sale. It was both for the annual fundathon, but also because during the month of April, Texas took a major anti-abortion beating. One week it was banned, the next week it wasn't, the next week it was banned, the next week it wasn't. Like, I'm literally not kidding, it was that bad. So at that time we were okay, like reallocating our funds. We were in constant communication with the clinic, like crying, like it was just such a mess trying to help people get to where they needed to be. So sort of like with all of that going on and with fundathon going on, we sort of like came up with this idea to like, we usually have a bake sale, but we thought, let's just do it virtually. Like, well, not virtually, but we can do this. Like, let's just like do no contact. We figured out logistics. I tweeted about it. I tweeted, hey, I think maybe we should do this. And it was the most beautiful sight to everyone just be like down. So we took to like we were rejoiced by the response. Other folks from other parts of the valley were down to bake and fundraise as well. So, and someone even in Austin, 5 hours north of us. So we ended up raising close to $3,000, even in a pandemic, through a bake sale. And this was all based on the power of our community, because you had people were buying brownies, we're buying muffins, and even we're just like donating. We're just like, you know what, like, this stuff ain't right. Like, we need to do something about it. They're not doing anything about it. So let's take it into our own hands, because our communities are, you know, that's what community is for. And lastly, I would suggest using the media. That is a platform that you can use. So while we didn't think about, sending out press releases, I don't know why I didn't think about it, but that's also something you can do. We didn't think about, because we were so overwhelmed, with the response. The like us promoting the bake sale actually generated like a lot of social media traffic. So a few media outlets actually reached out to us, about the bake sale. So not all, and we were, on the news a couple times, on the newspaper. So not only did that increase donations, but it also did amazing work to destigmatize abortion in our mutual aid effort. So it was like sort of like a resource we didn't even consider that really worked. Like, we literally had people say, oh my god, I saw like this on the news. And we really saw like it be used as a way to destigmatize abortion, because a story about selling brownies for abortion, and there was no pro-life person interviewed. It was thinking this is such a cool thing in Texas, like, when and where, and it really did. So even in such like an isolating time, in the brink where we're learning about this pandemic, we're still in it, right? But that was sort of when it was really, really, really like, wow, it hitting us, right? For the first time that we like could fathom it. We just couldn't put into words, even though we were at home, how much community we felt, how together we felt, and how it was directly supporting our abortion fund, and people were and still are able to get funded. But I feel like the most exciting thing was how instantly everyone was like, yeah, duh, let's do this. And it was all just so not really effort. It felt effortless because we had so much support. That's, I think, really the best way to describe it. So just have to remember, our communities are resilient. Where we shouldn't be used to fighting, but we are, right? So, communicate with your community, and they're here to support. We're here to support each other.
Thank you, Kathy. I know there's grassroots organizing, but when it comes to Texas and abortion access, that is something. Our next question leads to Noor. This question is, what tips would you give to a youth activist who wants to start a new mutual aid project? What steps should they take to start? What are the biggest challenges that you think come with starting a mutual aid project? And what are your tips to maintaining the project?
Thank you for these questions. So to start with, what tips I would give to a youth activist who wants to start a new mutual aid project. I guess 5 kind of steps. I would first start by finding a group of people with the same values and goals. And also, I want to note that if you're doing it alone, that's also completely okay. But you have to think really seriously about how you're going to take care of yourself through burnout. But know that that's not unusual. A lot of people who are saying we're doing this and that are really one person sitting there doing a lot of work by themselves. That's normal. That's totally okay. It makes you feel like an imposter, but you're not. It's the reality for so many projects and so many people. And then another thing I think is really important is that it's always best to work within your own communities and to remember that the best services are created by and for those that need them. And I'll go into this a little bit more later about why I feel that way. But step 2, I think, would be to make a concrete list of goals and to assess which ones are the most important to the community that they're serving and which goals can be achieved most quickly and how. You'll see that a lot of my steps are really making lists and just kind of taking stock of what resources you have and what resources you need. It's called organizing for a reason. You have to really get organized with what your strategies are and what's on the table. So those are my first few steps. And then step 3 is to list and get to know your co-conspirators. And what I mean by that is to see who is already doing the work or who's doing adjacent work. And you want to make sure you're not reinventing the wheel, as people say, when you're doing this. If there's already someone doing the exact project you're wanting to start, there's no need to start it again. Try to get involved with that work or see if there's ways that you can support it. If you see that there's a gap or they're unable to meet something, that's where you can fill in and start a project to help meet that need, fill that gap. And even then, it's still important to know those people doing adjacent work, get connected with them and help each other, because all of this work is coalition work. Work with others, let other people know what you're doing. That's the heart of networking, as I mentioned before. And then step, I think 4 is, oh no, this is actually a side note. It's really important, depending on what work you're doing, to look into internet security and how to protect yourself and your identity. Depending on what work you're doing, you might even want to consider doing it anonymously. And so pretty early on, you want to assess where you live, what are the legal restrictions, what are the social restrictions, what considerations do you want to take to protect yourself and everyone you're working with. And this is something people often put aside until it's a little too late and you're getting doxxed, but it's really important to think about very early on. Do not take that, you can't take that too seriously. Step 4, make your presence known, get on social media, put out flyers if you think that will help. That's not a strategy anyone should dismiss because it does still work. And also, more importantly, have ways for people to donate to your project. So if anyone comes across it, they can easily see how to give you money. You will see that if you have a good internet presence, you won't even have to talk to people. People will find you and you will just see supporters and money pooling up if you have a good presence of what you're doing and what you're trying to achieve. A lot of people right now are really thirsty for work that makes them feel like change is actually happening. So if you show them like, hey, this is happening, people with resources are happy to put it towards that. I hope that makes sense. And then step 5 is make a plan for long-term goals. So at the beginning, I mentioned, thinking about what the needs are and what immediate needs you can address, what you can do first off. But keep all of those other goals on the table as well. And it can be as simple as just putting together a Google Drive with documents and you have out your plans. You make a list of what would be needed to ideally achieve those things. That way, when an opportunity comes up, you can connect to it automatically. You don't have to start all over from scratch. This is important because you have to be flexible with deadlines when you're doing this kind of work, because it is very demanding and you'll set goals that you're going to have to constantly reassess. So be flexible with deadlines and leave room for people to come and go from the work. That way people can check in, check out whenever they have capacity. But that way those long-term goals are always still on the table and they're not things that are, this isn't our work anymore. It's just when there's time and capacity, you can come back to them. And then what are the biggest challenges that I think come with starting a mutual aid project? First off is challenging the desire to be a savior, which it's not wrong to be doing organizing work because you want to help others, because that's something that I think a lot of us are motivated by. But the problem comes when people believe that what they're doing is saving others from oppressive circumstances, or that our role is essential in other people's lives and narratives, when we put ourselves in other people's lives in a way that is inappropriate. And so while it's true that the work we do has the potential to change the world, we have to recognize that we cannot personally change the circumstances of any individual person's experiences. We can provide resources, we can share what we have, and help others to do the same, but we should never see ourselves as agents of change in any person's life that we're supporting, nor should we think of ourselves as being better or more knowledgeable than anyone that we are serving. And that's something that I see happening in movement work a lot, and I think it leads to a lot of problems because there becomes this disconnect with the people providing services and the community that they are serving, and that's inevitably just not going to work. And I think that if we as organizers exist to serve our community's unmet needs, then we should be working to make our position unnecessary to resolve the problem, not to force others to rely on us so that we feel important. And this is why it's important to only work within your communities and to approach helping others with the respect for their autonomy and their lived experience, especially if you don't share it, but even if you do, because it can be easy to project. We often come into this work because of the intense highs that it brings us to solve problems and to help others. But we have to remember that the lows are just as intense, if not more intense sometimes, because there will be times where you can't help, where your resources, they dry up. The network has limits. There's something you can't do. And so being able to attend to whatever trauma motivates you into doing this work is really important. You have to learn to separate healing your own trauma from the work you are doing to heal others, if that makes sense. Because those boundaries are essential in making this work personally sustainable. And you have to remember that everyone you encounter in the movement is in a totally different place in that process. Some people are not even aware of that process at all. Um, and to kind of go along with that, another major barrier is burnout, which I talked a little bit about, and which, you know, people throw that word around a lot and it becomes almost a joke, but it's very real. It will happen. You should pretty much plan that you will get burned out and that it's going to be a consistent part of the work all the time, dealing with the burnout, because this work is extremely demanding and rewarding. And in that way, it becomes kind of addictive. So like I mentioned, those limits and boundaries that you place, you have to be really honest with yourself about what motivates you to do this work. And if you're doing it to attend to some kind of emotional wounds, then you have to learn to attend to that wound in other ways outside of your work as well, or it's going to really make it unsustainable. And then I also wanted to mention that sometimes it can be really easy to feel like if you're not doing something, it won't happen at all. So you have to keep doing it even at your own personal expense. And while it is absolutely true that, you know, the work you're doing might not be happening if you're not doing it, because we all have really valuable contributions, that doesn't mean you should keep doing it at your own expense or the expense of your relationship with your community, with other people. That again makes the work unsustainable. We have to take care of ourselves in order to be able to provide to our communities. So never feel like guilt should stop you from taking breaks, from saying no, from stopping the work, because it will always be there. You can always come back to it. There will always be more work to do, and within our personal lives. And this isn't something validated in movement work very often, but in our personal lives, there are many ways to be continuing the work without checking into meetings and posting on social media that you're doing XYZ and raising money. There are so many ways to attend to this work in our personal lives, and mutual aid work is something we do within our communities, not just as organizations. And then as far as tips for maintaining projects, collaborate with others as much as possible. Like I mentioned before, it's okay if you're doing work by yourself, but let people know what you're doing and look for opportunities to work with other people. It's the only way that you can make any of this happen is by building coalitions with other people doing this work. And then along with that, networking also means talking about what you're doing all the time, even when you think it's not relevant to the people you're talking to, because it's those unexpected connections that create the best kinds of creative innovation and the best solutions. For example, some of the things I've been most surprised by were connections with religious leaders who helped us find support for abortion seekers or house homeless people, whereas other nonprofit leaders or liberal government leaders were unable or unwilling to do that for us. And it would be, you know, you would think you should look to these people who are likely to help or you're working on similar areas, but it's someone who's completely in a different arena who has a creative idea or a resource that wasn't anywhere within your wheelhouse that is able to connect. I'm not sure if I'm making sense, but basically I'm just trying to say, reach outside of your own network, go outside the box, as cliche as that sounds. Talk about what you're doing with everyone all the time if it's safe to do so, because you never know when someone will overhear it and have money or a resource or an idea that can really expand your project in a way that you and nobody in your circle had ever thought of. Like it's a passion to me to connect people who are in circles that would never have otherwise been connected. And then before I go, I wanted to shout out one other mutual aid collective that is doing really awesome work in Texas. I couldn't fit them in my bio, but their name is Buckle Bunnies Fund. I don't know if anyone here has heard of them, but they're kind of filling a lot of gaps in the existing network of Texas abortion funds. And they're a completely grassroots group that I've had the honor of being invited to work with. Yeah, I don't even know what to say. They're just a really awesome group of folks who rose up to meet a need. Because obviously Texas abortion funds are amazing. They do so much work. But even with everything they're doing, there's still a huge gap. There's still a huge gap. There's so many people who cannot get funding, who sometimes don't even get on the phone with the funds, and who are just left in the lurch. And so this group of folks have risen up and just used all kinds of creative ways to source money. And that's another thing I want to mention is all of the really awesome ways that I see people fundraising these days. I particularly want to shout out sex workers for the way that we use sex work to fund these movements. And that's something that historically has always happened. Sex workers have always used sex work to fund the movement. Like shout out to Martha P. Johnson in particular. But, you know, I think that the way modern sex workers have to put ourselves on the line very visibly to do this work is something really admirable and something that we should all really respect. So I think that, yeah, just to kind of bring it full circle, I do a lot of work with a lot of different groups, and I appreciate all of the different strategies that people bring to the table in creating coalition work and creating mutual access for people who are at the bottom of those access. I think Seneca was saying, you know, when you're creating something, you have to start with the people whose access is most limited. You know, it's only when the people who are most restricted, when they have access to something, that's when you're truly moving forward. That's completely paraphrasing what Seneca said in my own words, but yeah. Thank you all again, and I hope that that answers some of those questions.
No, thank you. Lots of love for Buckle Bunnies in the chat. Thank you so much for sharing your tips on starting a mutual fund. Our next question goes to Kefri. What needs do you see as unique to young folks under 21 in your communities? How do you address those needs through your network?
Yeah, thanks for asking. So I'm just going to touch on a few of the things that feel most prominent for us. One of those things is access to emergency contraception, like Plan B and Ella. Ella is the 165 pounds and higher emergency contraception. So both by law in Oregon are available over the counter, and there's actually no age restriction, which surprisingly, there are pharmacies that still do not know that. And so we have, for instance, like gone to Costco to buy Plan B. They won't sell us more than one. They want to check our ID. And it's like, do you know there's a law? And like, you don't need to see my ID for me to buy this. And actually, you don't even need to have this behind the counter. It should be on the counter out in the shelf. And so we actually built a relationship with our local Costco, which is so funny. But now we buy bulk emergency contraception from Costco for like $5 a pop, which is amazing. And so now we've also started distributing that. And one of the partners that we distribute that to is our local chapter of Period Club, which is a high school group of really rad folks that are working to make menstrual products free in schools. So access to those resources is really important. Another thing that comes up a lot when we're supporting youth through abortion is parental consent and navigating the laws around that. If you're covered under your parents' insurance, how do you keep that a secret? And there are ways, every state has different laws about parental consent. Sometimes you only need one parent, other times you need both parents. And then in Oregon, you don't need either parent consent. So, but you still have to be able to navigate your health insurance coverage. If you're covered by them, how do you keep those records private? And so a lot of that is like information sharing and educating people about what the laws are and how we can help them. And so let's see, the other thing I was going to say was pregnancy tests, helping people. There's a lot of stigma even around just going to a pharmacy or a Rite Aid or whatever and buying a pregnancy test. And so we offer free pregnancy tests as well. We also, in addition to offering them these supplies, we give them information about where else you can get these resources, telling them that emergency contraception is actually covered by OHP. If you have OHP, you can also get it for free there, and other places you can get it, because we don't want them to be dependent on us, even though they can always come back, but just that like there are resources and they can access those at any time as well. And then the last thing I'll add, which is such a broad one and maybe not something that we've really been able to tackle completely, but just sexual and reproductive health education, something that includes abortion, but also talks about sexuality and gender and how all of those things interact, and destigmatizing abortion on its own. a pipe dream of ours is to partner with the Portland Public Schools and figure out a way to support them in educating their students about abortion in particular. So one day.
Yes, thank you. I want to thank our speakers for talking today, and I want to go ahead and now open up the floor to our chat. So if there's any questions, Emily, do we see any questions in the chat?
So first question is for you, Victoria. Where did you get that Against Abortion Have a Vasectomy t-shirt?
Oh, I got it from Change. It's with a CHNGE, I think.
Great. And then the one question we have right now is, if you are not part of the communities that are the most marginalized, how can you work in a way that is meeting people with most need, but not stepping into a place where you shouldn't be and perpetuating white saviorism?
Can I offer one? I think that it's important for people to recognize that, and I think we've touched on this, that there is a necessity for a deep social and cultural shift about notions that we never even talk about, things like the deserving poor, whether or not a problem is for you, whether or not you think you have the right, the skills, the experience, or even the capacity to get involved in something. Certain categories of people, certain whole demographic blocks of humans, particularly in the United States, don't question whether or not this is something that they should be involved in. And oftentimes when you're not aware of particular, your gender or your race or your class position has socialized you to think that it feels very natural for you to want to go to the first of all, that you could even understand who the most marginalized people are, but that you go directly to them rather than talking to your cousin who is a stormtrooper uniform wearing neo-Nazi and dealing with the situation. This is an example that is coming directly from my lived experience with some of our volunteers. They wanted to go to North Philly and help those poor people, and they literally had full fascists in their family. And I'm like, girl, you're too busy. You don't have time to help those quote unquote poor people. And I use that as an example because what we're talking about and why mutual aid and also abortion liberation is so central is because at the root of it, and that is what makes it radical, is that we are asking individually and collectively as a whole group of people for us to change how we think about how we fit in our society. Some things are not for everybody, and that the work that you should be doing, the most critical work that you should be doing, which I think is a more liberation rooted question than like how do you help the most marginalized people, because that's really rooted in a white feminist philanthropic lens, is actually what is my community and where should I be working on liberation work? And I think all of our panelists have said this, but that there is always something you should be doing, not that you could be doing, but that you absolutely should be doing in your house, on your block, and in your neighborhood. And I think the problem with white saviorism and sort of like the whole settler mentality is that we are always saving those poor Black and brown people from themselves, but absolutely not doing the real radical work that comes with underpinning abortion access, which comes with underpinning the deep grinding poverty that is framing every single issue that we've talked about, right? You know, so many of the people who support Women's Medical Fund say all the time, like, yeah, I love abortion because poor people shouldn't have children. And you're just like, so it doesn't happen often, but it happens enough for you to be like, so, you know what, actually, we're not, and we need to have a conversation. And for those people, they're giving to Women's Medical Fund because they believe in something that isn't in keeping with the spirit of the fund. And we have to have a come to Allah moment with them. And we're like, so I know that we're doing something that you think is important, but the reason why you're doing this thing is actually extremely harmful and it doesn't get us free. And we don't need your money if you're doing this, that, and the third. And so I would say that, first of all, we save ourselves. And that goes for Black and brown folks and Indigenous folks, as well as white people who absolutely need to get each other all of the way complete together, all the way together. And we see that every single day, right? in the big and small choices that people with authority, especially to wage violence, do. And so if you ever feel like you're not a part of a community, that's great. That's a first step. That means that you're not a part of that community. And that gives you an opportunity to reflect and review where you should be working with your own people. And I think particularly if you're someone who is a woman, particularly a cis woman, we are socialized to not problematize those intimate bonds we have with the people that we love, that gave birth to us, this, that, and the third thing, that we're sleeping with, that we're married to, drag it all out. This is the work that supports white supremacy, and particularly when white cis women don't do that work in favor of becoming social workers and helping those poor brown children, you know, in the South Bronx, then the problem perpetuates itself. And so my short answer is, do not go to communities that you don't belong to save people. They don't need your help. But that more than anything, if you follow like the true principle of what we're talking about, there is work that is absolutely critically needed in your community that you probably haven't realized is of a critical need. You just need to be a little bit more reflective. And also, I think to the point that everybody's made, chances are good, there's actually already white people gathering each other in that space, and they're waiting for you to show up. And so like, that's my short, long answer for that it, don't go, stay at home. Work on what's going on in your own backyard, because that is actually extremely critically important for us to get free for real, and not just to keep doing this until the end of time.
Victoria, I can share another question, which was, I think for Kefri, it was, how did you start negotiation with Costco, or how did you get Plan B so cheap?
Yeah, so basically I just went in there and I was just like, I was having a good day. I was feeling like I could really advocate for the cause. So I just was like, went in there and did it, and continued to go in there. I went in there a few times, built a relationship with the pharmacy manager there, and she is actually super rad, and she had to like talk to the leads there, like the CEO folks, which was crazy because I'm like, how are you gonna ask them and not just like see that this is a law? And then at least at Costco, the $5, it's like $5.75, and that is standard price. So you can actually go there if you have a Costco membership and get that same price by just buying one.
Wow, did not know that. And another question came in, what can organizers do to make sure that mutual aid projects are building power in communities and not encouraging reliance on organizations or the state, capital S?
Could you repeat the question? I'm sorry, I had a child interruption, so I didn't get to hear it. Parenting in real time. Everything's great. Could you repeat the question? I'm so sorry.
Sure. What can organizers do to make sure that these mutual aid projects are building power in communities and not encouraging reliance on orgs or the state?
I can quickly chime in and just say that when offering resources, the offering of information, the opportunity for them to then empower themselves and not build a reliance on you, I think that is what, at least for us, has been a really powerful way to provide resources. I'd love to hear what other folks think about that.
Yeah, I definitely would agree with that. Oh, I'm sorry, Seneca.
No, go ahead.
Okay, thank you. I would just like to quickly add, I think that this sounds a little bit basic, but especially when you're just getting down to the grit of, you know, in the pandemic era, particularly mutual aid projects, people really just need money, and they deserve the autonomy to decide what to do with that money on their own. Like, we know in our society, everybody just needs money. It's not something we can get past, and trying to shame people for needing money to survive is pretty ridiculous. Anyone engaging in that is obviously, doing it somewhat illogically to try to justify an oppressive behavior, because everybody needs money to survive and we all deserve self-determination and how to spend it. So I really think, just at the very basic level, what you can do, whether you're part of a community or not, is just share those resources directly. Don't share like a gift card or pay a landlord. Give money to people. Give people resources directly and let them decide what to do with it. I think that the problem with the nonprofit industrial complex is that sometimes it adds in all of these layers of bureaucracy that are really unnecessary. And it's built into the structure. It's not necessarily the fault of the people running these organizations, but I do think that there is a need for nonprofits and there's a need for grassroots organizations, because there are different things that each can accomplish. And that's why nonprofits have to boost the work that grassroots groups are doing, because they're often filling a need that nonprofits can't. And so I really think at the root of everything, we all know that people need money, that poverty is a problem that causes a lot of the issues we're trying to solve. And so if you have money and you have a resource, give it to people and let them decide for themselves how to use it. Don't gatekeep that, don't gatekeep access to it, and don't tell people how to use it or what they need to have in order to deserve it. Just give people money. Also, don't give it to nonprofits on behalf of people. Give it to people directly.
Yes, I was just going to say that WMF has been a nonprofit after 35 years for about 14 minutes. And I spend so much of my working day trying to figure out how to literally move money to people in the community. But we quite literally can't. We can't. They will not let us do it. Well, you got to have a receipt. Well, I just gave $50 to the dude on the, I mean, what are we doing? And it is the most infuriating thing, because also you see sometimes in movement spaces, people are like, well, once I get that 501c3, then I'm legitimate. And, I was an anarchist before this. I don't care. Do not become a nonprofit, because your ability to do real work will be hobbled. And that is something that people really, because again, there's this pressure that you're not legitimate or like There are all kinds of things that they will dangle in front of you, little carrots, little sticks about like big grants and this, that, and the third thing. Don't get sucked into it. Like I said, this is the natural state of our communities, to care for each other and to share resources. There's a saying, as someone who's been a sex worker her whole life, I'm always telling people, it's like, hoes teach us how. And we know there's like this really saying that sex workers have been sharing that same $20 all over the place for the last 500 years. And that is very, very true. And so when you have faith in the community's ability to meet their needs without this filter of the deserving poor, and is this programmatically this, that, and the third thing, and blah, 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 suddenly the ability to truly change people's lives becomes a lot more possible. And I think the example that I have from that is that one of the things that we experienced, surprisingly, was a need for pregnancy tests. I shared in the chat, I had become pretty notorious in the tri-state area, because in the height of the pandemic, here's this Black woman going to every Dollar Tree. And when I say every Dollar Tree, I mean every Dollar Tree in New Jersey, Philly, and Delaware, buying the specific pregnancy tests that don't have the cup, because particularly for people who are unhoused, you need to just pee on the test. And it's extremely important when deciding to continue a pregnancy or terminate a pregnancy to be sure that you're pregnant. We found out that our opposition, in addition to pretending that you can take a pill to reverse an abortion, they were also back to their whole like, come in, we'll give you a pregnancy test, we'll get you in Section 8, da, 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 da. And in a really unexpected way, we became like, we just had to get our hands on pregnancy tests. And there was a moment with other groups that I just was like, you can just buy pregnancy tests at the store. And people were like, what? And I was like, yeah, so these are from the Dollar Tree. They have Dollar Tree on them. We are buying hundreds of dollars worth of pregnancy tests because, we're putting them in bundles. We're throwing like sacks of them towards people. But like, please let people know, because we're letting people know all the pregnancy tests work exactly the same. They're all very accurate, da, 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 da. And that even in that extremely small way, being able to remind people that they quite literally had the actual economic power to do this thing that they had suddenly thought, even though we had just sort of showed up in their lives, like, oh, I need to get this pregnancy test from this abortion fund. You don't need to get this pregnancy test from me. I mean, I'm just here giving it to you because you literally have no cash, but they're all the same. And in this really amazing way, that underlines why mutual aid is different than direct service, we were able to remind people that they absolutely had within their disposal the ability to like do this thing that they identified for themselves that they really needed. Because at some point, condoms and EC are irrelevant. I need a pregnancy test, and they couldn't get them anywhere. And just being able to consistently not only remind our community that like, yep, we have these services here and we will always make them available to you because I have this, you know, corporate card and I'll buy it all, but reminding service providers, people that you can use any of these things. They're all acceptable. These people are lying about whether or not they're useful was extremely important. And I think that that's just like the smallest example from the million examples that we had in doing this work, both directly related to abortion, but particularly in our communities, is that we normalize restriction. We normalize the myth that governments are all powerful and all seeing and all knowing. And again, we have got to shake that table, pick the table up, throw it out the window, because we are enough. We already have strategies that work. We're doing it all the time. You know, the same amount of effort that it takes to fund an abortion is exactly the same amount of effort that takes to like keep your lights on or pay childcare or get grocery money together. And our community members know how to do that. So when we talk to them about funding abortion and robbing Peter to pay Paul, they know exactly what we're talking about. And so there's no part of this experience that is foreign to them. But when we say to them, it's like, so we are actually on a arguably larger scale, just doing the exact same thing that you do every day, they get it. And it's a different relationship. It's not a transaction. We are working together to get us all free. And I think that whether it's paying for people's abortions or giving them pregnancy tests or helping people figure out how to do their own abortions in clinical and non-clinical setting, that is the shift. That's the important thing. Because once you teach somebody how to take mifepristone and misoprostol in a combination, that will terminate a pregnancy and expel the products from the uterus, they don't have to keep coming back to you, but they will, because they want to be able to share that information with other people. So train the trainers, give them the resources. Don't hoard money, don't hoard info.
Yeah. No, for sure. Thanks. I just wanted to touch real quick before we go to the next question, because there's some really good ones. And it's real brief, you know, like I've always felt, and how I even learned, you know, a lot of what I know in the movement is the power of storytelling and having these conversations. You know, people really begin to get an understanding of sort of like why we're doing the work and like why mutual aid is meaningful. And when you become in tune with your community and sort of understanding why we're being disenfranchised, right? Everyone sort of has an understanding too, and is like much more like excited to help each other out. So just everything y'all said is like, oh my God. But I just wanted to throw that in as well, that, you know, just info sharing and storytelling really does wonders.